Hello, I'm Stephen Breita, and I thought we'd spend a few moments talking about the difference between diabetes mellitus type 1 and diabetes mellitus type 2. Diabetes mellitus type 1 used to be called juvenile onset diabetes because the vast majority of cases occurred in children or adolescents or very young adults. Now we know, however, that it is not at all rare for older adults to have this kind of diabetes also, so it would be too confusing to continue to call it diabetes mellitus juvenile onset. Diabetes mellitus type 1 is basically caused by an autoimmune attack on the islet cells of the pancreas. These are the cells that produce insulin as well as other hormones related to metabolism. The result of this attack is ultimately the destruction of these insulin-secreting cells and diabetes. Diabetes mellitus type 2 used to be called adult onset diabetes, but now, especially these latter days, we see many cases occurring in teenagers or even in children. So we really can't call it adult onset anymore. We call it type 2. We don't really understand the pathophysiology or the cause of diabetes mellitus type 2. Probably genetics has a great deal to do with it. And of course, there's some defect in the beta cells, some insufficiency of insulin, and some resistance to insulin on the part of the cells elsewhere in the body, but we still haven't gotten really to the bottom of it. We do know a great deal about therapy for type 2 diabetes, and this usually consists of diet and weight loss and exercise, and sometimes diet and exercise alone are sufficient. Usually, though, for newly diagnosed diabetes mellitus type 2, a pill, a so-called oral agent, is required in addition to diet and exercise. And unfortunately, as the years go by, many years of diabetes mellitus type 2, occasionally insulin is required. But in all cases, diabetes mellitus type 1 or diabetes mellitus type 2, if the diabetes is well managed with diet and whatever else is required, the person involved can lead a normal life and can enjoy a normal or very nearly normal lifespan. Well, I hope that clears up a little bit of the problem concerning the difference between diabetes mellitus type 1 and diabetes mellitus type 2. Thank you for listening.